Morning students, I am Aida S. Varghese, a lecturer of Emmanuel University College of Pharmacy. Today we are going to see about pharmaceutical suspension. Then cross diffusion. These are the biphasic liquid dosage form in which the particle size of the dispersed phase range from 0.1 mm. This is mainly two types, then suspension and emission. And first topic is a suspension definition. A pharmaceutical suspension is a cross dispersion in which internal phase therapeutically active ingredient is dispersed uniformly throughout the external phase. Then internal phase. The internal phase consisting of insoluble solid particles having a range of size 0.5 to 5 microns, which is maintained uniformly throughout the suspending vehicles with aid of a singular composition of suspending agent. External phase. The external phase suspending medium is generally aqueous, in some instance may be an organic or oily liquid non-oral solutions. Then types of pharmaceutical suspension: antacid oral suspension, antibacterial oral suspension, analgesic oral suspension, dry powder of oral suspension, anticoagulant oral suspension, anti-emetic oral suspension, antifungal oral suspension. Then classification, first one. Then based on the general classes: oral suspension, paracetamol suspension, antacid. Then extremely applied suspension, calamine lotion. Then parenteral suspension, example procaine, penicillin G, insulin zinc suspension. The next one based on the preparations of the solid particles. Dilute suspension, concentration range from 2 to 10% weight by volume solid. Example cortisone acetated. And second one, concentrated suspension, concentration range from 15% weight by volume solid. Then example zinc oxide suspension. Then diagram of dilute and concentration. And then water flow and semi-permeable membrane. Then next one based on the size of solid particles, colloidal suspension. Colloidal suspension having a particle size of suspended solid less than about 1 micron in size are called as a colloidal suspension. Then second one, cross suspension. Suspension having particle size of greater than about 1 micron in diameter are called as a cross suspension. Then true solution of particle size less than 10 raised to 7 centimeter. Then colloidal solution particle size between 10 raised to 7 centimeter and 10 raised to 5 centimeter. Then suspension particle size greater than 10 raised to 5 centimeter. The narrow suspensions are by the biphasic colloidal dispersions of nano-sized drug particles stabilized by the surfactant. Size of the drug particles is less than 1 millimeter. Then advantage: suspension can improve chemical stability of certain drugs. Then example procaine, penicillin G. Drug in a suspension exhibit a higher rate of bioavailability than other dosage form. Order of the bioavailability: solution greater than suspension, greater than capsule, greater than compressed tablet. Disadvantage: physical stability, sedimentation and comparisons can causes problems. It is bulky and sufficiently care must be taken during handling and transport. It is difficult to format. Uniform and accurate dosage cannot be achieved unless suspension are packed in unit dosage form. Then sedimentation value, suspension quantitated by the sedimentation value, the diagram. Then preparation of suspension. Following consideration are important for manufacturing pharmacist. Then selection of right material that go into the manufacture. These steps involved their sequence in the manufacture, preservations and storage of the product. Then packing of suspension. Pharmaceutical suspension for oral use are generally packed in mouth container having adequate space above the liquid or ensure proper mixing. Then parenteral suspension are packed in either glass, some of us or the vessels. Then thank you.